Are you considering an MMA surgery at all for yourself?
It's a good question. Am I considering it, or would my wife let me? Because those are two very different, different.
That's my problem too.
Yes.
My wife doesn't want me to. She
Yeah.
really won't let
So,
me.
I certainly, it's interesting because my own path, and I don't know how I ended up in sleep apnea because it happened to be totally unrelated, but like now I'm like the same phenotype as so many of these patients where like I played volleyball in college and like I would get horrible neck spasms where like I would turn my head in a certain way and all of a sudden one side would completely seize up. And I would have to have our trainer work for like hours, like digging in and trying to like loosen it up or like wear heating packs on one side. And I think a big part of that was posturing. Like I kind of have my neck forward because I have retrognathia. I had narrow palate. I also have some retrognathia, and I certainly could benefit from a jaw surgery. I just
I caught your side profile. That's why I asked.
What's that?
I caught your side profile a few times during the chat.
Yeah, no, exactly. So I've personally, sorry, my dog's scratching on the door outside. So, I've thought certainly that would improve things, and I still probably am on the spectrum a little bit of like UARS or kind of unrefreshing sleep, but having two small kids and a busy job certainly doesn't help my sleep quality either. But it's crossed my mind.
Yeah. Okay. And so if you were to get serious about it and all of a sudden you're like, hey, you know what? Like I have a window, the kids are now all at school every day. And, I have this opportunity to take this short sabbatical. How would you go about planning your own jaw surgery? Who would you see? How many surgeons would you see? What would you be looking for in order to get a consensus on what would be appropriate surgical movements for you? What's your thought process on all that? What advice would you give to other patients who are considering a jaw surgery?
Even patients that come to see me that I'm recommending jaw surgery, I never recommend against a second opinion. So I don't think it hurts to see, two or three people, or some people obviously, if you start getting up to the 10, then you're kind of probably searching for something that doesn't exist.
Yeah.
Or you're not kind of mentally ready for it, in my opinion. But,
yeah.
I would probably look at my own CBCT, look at my own kind of pictures, front, side, all these different things, and kind of look at my own, how I would plan my own surgery, and then probably go see a couple different surgeons like Gunson and some other folks to get their opinions on, is it similar to what they would do or kind of what their thoughts on recommending something like that would be.
Yeah. No DIY jaw surgery, right?
Not yet. I didn't put the marpe in myself. Maybe I should have considered it with like a little mirror or something like that. But yeah, no, I think I would probably pre-plan things and figure out where I think things should go. But then obviously I would want to get opinions from the people that I would be seeking something like that out. And I think it's interesting to get different opinions because it's, everyone says, oh, it should be like it's a science, not an art, but jaw surgery, there is a big artistic component to it. So I think, maximizing the advancement while still kind of maintaining cosmesis and how you're kind of improving airway versus the cosmetic nature of things and all that.
Yeah. There's all the movements that the surgeons offered to me were quite similar.
Yeah.
And yet all three treatment plans that I was given were all very different too.
Yeah.
Like Gunson wants me to do some very specific orthodontic work and restorative dentistry and some, certain diagnostics before he'll do the jaw surgery. And then Dr. Wallin is more like, I like to keep it simple. I don't want to add a restorative dentist and another orthodontist into the mix. I want to keep it simple for you. Let's just do this. And then, Dr. Bell is like, well, it's up to you. Can you tolerate more orthodontics, or do you want to take a more streamlined approach? We can do it sort of all these different ways. There's no one way up this mountain. And it's like, I didn't realize that there was so many different ways of going about it. But there are.
Yeah, there's a lot of nuances with both pre and post-op care and kind of pre-operative planning. And I don't know that there's any one, perfect answer. I think, some people would say, okay, well, if you're going to line up everything perfectly with orthodontics and restorative dentistry and having every teeth in the perfect place, is that going to optimize your outcome? And Hard to know. I think certainly the more attention to detail you have is better. But I think there's so many different ways you can go. And is your airway going to be just as good no matter what? Probably. If there's similar movements, the airway result is probably going to be the same. It's just some of these other things that are a little bit more nuanced.
Yeah, right. I mean, I'm an aim small, miss small guy where like let's really hone in on the fractions of a millimeter here in my teeth to make sure that we get, the optimal surgical outcome, right?
Yeah.
But I'm also been in orthodontics for over 8 years and I'm totally freaking burnt out. So it's like, but I think that's dangerous
Yeah.
because I don't want to make a lazy decision when it
Yeah.
comes
What
to
you're
the
doing,
most
100%.
consequential treatment, right?
Yeah, no,
Um,
I mean that's a big thing to consider is like if you're going to invest this much time and energy in recovery, like you want to make sure it's done the right way. And that's a lot of patients. There are patients that again in my practice that are like, oh, I don't want to do ortho. I'm like, hey, this is a big surgery that we need to do the right way, and we need to kind of make sure your teeth are lined up, and we're not just going into something and sure your airway is going to be open, but now your bite is off, and is that going to contribute to TMJ dysfunction down the road and or condylar resorption because your teeth are hitting incorrectly because we didn't line things up. So I think, there's different ways to look at it. If you're really going in and your your AHI is 80, we need to get you corrected. We can't put you in 2 years of orthodontics to do that. So we kind of do our best. So it depends on what you're going into it to resolve and how severely symptomatic the patient is.
yeah, yeah, no doubt.